Hi, Greg. It's good that we've got an opportunity to have a chat about the things that we're going to talk about: anxiety, worry, and pulmonary hypertension. But I know you very well, Greg, because you've been working with us as an organisation for about 12 months, 15 months, something like that. Well, Greg, can you, so people who are listening to this, watching this, just introduce yourself, tell us what you do, why you're doing what you're doing.
Yeah, absolutely. First of all, thank you very much for having me. I look forward to having this meeting with you, Iain. So my name is Gregg Rawlings. I'm a trainee clinical psychologist. I'm in my final year of training at the University of Sheffield. And as part of my training, I'm required to do a piece of research. And my research is focusing on anxiety in pulmonary hypertension. And that's what I'm here to talk today about.
Right, good. Cheers, Greg. Two questions, Greg. Can you tell me what a psychologist does, and could you explain your accent as well, because you've got strong accents, just so people really, I quite like it, but just explain where you're from as well, Greg.
Yeah, of course, yeah. So I'm from Sunderland originally, and so yeah, sorry about my accent if it's a bit strong.
No apologies necessary, but and psychology and psychologist, what do you do?
Yeah, that's a good question. So as I say, I'm a trainee clinical psychologist. A psychologist is a specialist in mental health. We work with clients who have difficulties in things like psychological factors, emotions, behaviours, and also clients who have physical symptoms. A clinical psychologist doesn't normally prescribe medication, but we work alongside colleagues who do. The type of care that we provide is often called talking therapies or doing therapies. We work across services, but our role can be varied. And we're also involved in research and also service development and implementation of interventions.
Greg, just to give some clarity, give us a couple of examples of these talking therapies that people might have heard or be familiar with. We might explore them in this conversation, but a couple of examples, name them.
Yeah, so there's a range of different types of therapies. A common one that many people might know is cognitive behavioural therapy, CBT for short. There's also things like ACT, acceptance and commitment therapy, and we also offer interventions like psychodynamic therapy as well.
Yeah. Right, Greg, in context of pulmonary hypertension, one of the reasons we're keen to work with yourself and your colleagues and things is that we did some work as an organisation last year, 2019, an impact survey about how pulmonary hypertension affects people and the day-to-day lives, etc. One of the things that came out of that, so this was a study just last year, 2019, it showed us that 53% of people with pulmonary hypertension have experienced or have been diagnosed with some level of anxiety or depression. So two questions to you as a psychologist. Are you surprised by that? And what does it tell us, do you think?
Yeah, I think, first of all, it's really important to acknowledge that we all experience anxiety, and we've all experienced anxiety in our lives. Anxiety is really common. And when we look at people who have a long-term health condition, for example, we know that they're more at risk of experiencing difficulties with anxiety. So when we look at across the general population, for example, in the UK, roughly around 6 out of 100 people experience levels of anxiety to a degree where they may benefit from.
Greg, can I just stop you there and could you try and explain to me what anxiety is? What is anxiety?
Yeah, that's a really good point. We often use anxiety in our everyday language, and there's many words that we associate with anxiety, for example, worry, stress, panic. Anxiety can be split into kind of 4 different types of symptoms, and this would be using a cognitive behavioural therapy approach, for example, where someone has cognitive symptoms, so cognitions meaning our thoughts. So there can be thoughts associated with anxiety. So, for example, worry. They can be emotions linked with anxiety. So feelings like panic. There can be what we call physiological symptoms. So these are kind of symptoms in our body. So it might be, for example, feeling tense or feeling like we have butterflies in our stomach. Very common. And then finally, there's some behaviours linked with anxiety. So, for example, a kind of common one would be avoidance. If we're anxious about something, then we're more likely to avoid it. Another behaviour of anxiety is reassurance seeking. You know, I'm pretty sure we've all left the we've all been left the house in a rush and worried about whether we've locked the door, and we speak to someone, or we ring someone at home and ask them to check on the door, and our anxiety is reduced all the time.
Okay. And is anxiety necessarily a bad thing?
Anxiety is normal. We all have anxiety. Anxiety is something that we have so our anxiety response is something that we've inherited from our ancestors. Anxiety keeps us safe. Anxiety serves a function. For example, if you're lying asleep at night and the fire alarm goes off, you want your anxiety response, because that will get you out of bed, it will get you out of danger. Anxiety also makes us think about our health, for example. You know, if we weren't anxious about our health, then we wouldn't necessarily eat healthy or live a healthy lifestyle. So I think it's important to recognize that we all have anxiety, and it's normal. And you may be going through something in your life where you experience more anxiety or greater intensity anxiety. But there are times where anxiety can be unhelpful. And that's where it can be really supportive to speak to people about that. So, for example, when you're experiencing really high, intense anxiety, or you experience anxiety for a long period of time, or you're experiencing anxiety to an ever-increasing number of triggers. Yeah.
It's interesting, Greg, I think, as you talked and you just touched upon some of the signs and the symptoms of anxiety. They actually sound very similar to some of the symptoms we see in pulmonary hypertension.
Yeah, I think that's a really important consideration that you made there, Iain. Thinking about the overlap between symptoms of anxiety and symptoms of pulmonary hypertension. There's certain symptoms of pulmonary hypertension that's specific to the condition. For example, bloating, swelling. There's symptoms specific to anxiety, for example, racing thoughts or feeling tense. But actually, there's some symptoms that can overlap between the two experiences. So things like dizziness, fatigue, tiredness, tightness in your chest, difficulty breathing. These could be symptoms of pulmonary hypertension and anxiety. And upon hearing people talk about their anxiety with pulmonary hypertension, we know that symptoms of anxiety can influence symptoms of pulmonary hypertension, and symptoms of pulmonary hypertension can influence symptoms of anxiety.
And it is really important, isn't it? Because if you've got a higher level of symptoms, let's say you talked about being more breathless or chest pain, if the actual origin of that really is anxiety that's slightly got out of control, there's no point in trying to treat that with pulmonary hypertension medicines, for example. We've got to understand it. And I think it's one of the things that I find really helpful, what you've said already, Greg, is that anxiety is just normal. We've all got a level of anxiety, and things happen, come along in our lives, like a diagnosis of pulmonary hypertension or other things, and it can focus it. And we're talking now in this podcasting in December 2020. We're in the midst of the pandemic, the COVID-19 pandemic, and I know we've done some work with you, Greg, which we find really helpful. We've done the work with you so we can know as an organisation how we can respond to people's needs. You've done some research into the psychological impact of the pandemic with ourselves or people with pulmonary hypertension. Can you just give a bit of a resume of that?
Yeah, absolutely. I want to thank you for kind of pointing out that, you know, anxiety is normal, and we do go through experiences in our life. And as I say, living with a long-term health condition can be really distressing, and it really kind of impacts on our life, a considerable impact. And there's lots of emotions attached to that as well. So pain, for example, and fear, anxiety, low mood, and all of these in some ways are natural, normal reactions to a difficult life event. Something that we're all experiencing at the moment, as you point out, is the COVID pandemic. And we know, looking at the general population as a whole, that symptoms of anxiety is higher than what we would expect in kind of the normal population. So that suggests that there's a lot of anxiety around at the moment, which, you know, makes sense in response to what's going on. And yeah, we looked at the impact of COVID-19 on people with pulmonary hypertension, and also how people are managing with the impact. So we had 121 participants take part, and we asked them to fill out some questionnaires, which measured things like anxiety. And we also asked them to write almost kind of freehand about how has the pandemic affected you. And lots of really important information came out of that, and that information can be used to inform services and treatments. So things like being disconnected from our loved ones, not being able to go out and feel that kind of reduced independence, the feeling of loss, that's a big one. The fear of catching the coronavirus. People with pulmonary hypertension were shielding for a large portion of this year. Not only fear of catching it yourself, but fear of passing it to loved ones. And then also the fear of our loved ones catching coronavirus as well. So a lot of kind of normal responses to a difficult life event, and the added difficulty of living with a long-term health condition can also present challenges which are specific to their circumstance.
I find that helpful as well, Greg, and I think because if we can understand that it's normal, we're more likely to talk about it and seek help and share it. And sometimes just people sharing their stories with other people experiencing the same level of anxiety can be, presume that can be therapeutic. It can be a real benefit. It could be a real benefit.
Yeah, absolutely. There's real power in sharing our story, but also hearing other people's stories. It's quite common to think that you're the only one experiencing these difficulties, and upon hearing other people talk about theirs, that can be really normalizing. Unfortunately, there's still a lot of shame and negative emotions around experiencing difficulties with mental health and mental well-being, and that can be a large barrier for many people speaking out. I know we've come a long way in the last 5, 10, 15 years, but unfortunately it's still a barrier for many people.
Yeah, I mean, I think there is and that's a societal thing again, and it's interesting. I work in the pulmonary hypertension field. I've done for 25 years, and I probably would say it's only in the last 5 years that a penny dropped in my head that when I'm speaking to people with pulmonary hypertension, the families and the loved ones, etc., is that I'm not just talking about symptoms of pulmonary hypertension, but this is just part of it, so that our mental health and well-being is just part of the normal thing. So not only what level of breathlessness we've got, what level of anxiety we've got, what are we worrying about, and that becomes part of the norm, and it sort of takes some time for the penny to drop. Which leads us on, I think, Greg, quite nicely to this idea of seeking help when it's out of proportion, when we think we've got a problem. How, from your expertise, how would you sort of identify or help people to identify that my anxiety is more than just a healthy, normal part of things, and it's out of proportion? What would you say? Look for these sort of signs, symptoms, feelings, etc.
Yeah, I think that's a really important point you make there, Iain. And unfortunately, there's not an easy answer. Anxiety is what we would call a subjective experience, which means that everyone experiences anxiety in their own way. How you experience anxiety is different to how I experience anxiety, and what triggers your anxiety and how you cope with anxiety is different to me as well. I think the kind of take-home message would be, if you are experiencing symptoms of anxiety and you feel like it's negatively impacting the way you want to live your life, then I would recommend that you speak to your GP. That will be your kind of first point of contact. and also other members of your healthcare team. So I'm aware that some people listening to this will be under the care of a specialist PH centre. But there's also other resources out there. So for example, self-help, and there's also other services out there. So for example, PHE UK, Samaritans, Mind, and NHS website.
And I suppose as well, Greg, one of the potential normal things here is if you don't keep it to yourself, maybe the first port of call is to one of your loved one, a friend, a family, maybe somebody that you trust, rather than, sometimes it's quite difficult, isn't it, to have these conversations with the people that you're closest to. So identifying somebody that you actually trust. So you needn't necessarily just be a healthcare professional, just find friends and family, those types of things. You do mention, and it just leads, it's quite a nice segue this, I think, into sort of self-help and some of the work that we've been doing with you and in your studies. Can you again explain this? Because I'm really quite excited as from a PHA point of view, what we're doing with yourself and your supervisors, etc. Just explain it, Greg.
Yeah. So this is a project that's been done in collaboration with the University of Sheffield, Pulmonary Hypertension Association UK, and also Cardiff University. And we have developed a self-help manual for people who experience anxiety and have pulmonary hypertension. So now we've developed it, now we're looking to test it to see how helpful it is, how acceptable it is, and potentially how effective it is. So that's a project that we've set up, and there's information on PHA UK website, and there'll be a link.
Roughly, how does it work then? What when you say self-help, what do you mean? What would, if somebody was really interested, what would they be expecting to do? How does it work?
Yeah, so the first thing we would do is ask you to fill out some questionnaires, and that's just to kind of get to know you a bit better, and make sure that the project's suitable for you. And then you would be randomized to one of two conditions. The first condition is where you would receive the intervention, and the intervention consists of 4 booklets. I have one of the booklets here, and you would work through the 4 booklets each week, so 4 weeks in total. Partway through, I would contact you and just kind of check to see how things are going, answer any questions. And then once you finish the intervention, I will send you out some questionnaires to complete, and then 1 month later after that. And that 1 month period is to help us to know whether any of the gains that you've had as a result of taking part in the intervention has been maintained. And then we ask you to fill out a final acceptability questionnaire just to get your experiences of taking part in the intervention. If you're randomized to the other condition, which is the waiting list condition, in 4 weeks' time, you'll receive another set of questionnaires to complete, and then 1 month after that. And then if the booklets are found to be helpful, then you will receive the intervention at a later stage.
And so it's 1 booklet per week, and it talks about how you can self-help yourself, self-manage yourself. How long per week do you think it would somebody be committing to this?
It varies. The booklets, it's not a huge amount of pages. The idea of the booklets is that you go through at your own pace. Some people might read sections and think, you know what, I already know that about me, I can move on. But some people it might be, you know what, this is actually new to me, and I want to spend some time to really kind of understand this better. When we think about self-help or many interventions, one of the first stages is understanding and getting insight. Once we get a better understanding and insight of something, then we can think about the most effective ways of managing that. It's like if our car was to break down, we wouldn't just dive in and start kind of trying different things, although that might work sometimes. Another approach will be to find out why your car's not working, get some insight, get some understanding, and then you can have the most targeted way of managing that.
Okay, that's good. And I think one of the reasons we were very keen to collaborate with yourself and Sheffield University and Cardiff University with this is that it is for the very people taking part in this really quite important piece of research for their benefit, but it's also the big benefiting people that will come after them, who will be new to pulmonary hypertension potentially, and those sorts of things. Does this self-help manuals focus very specifically on anxiety in pulmonary hypertension? Does it just focus on anxiety?
Yeah, I mean, first of all, I want to say that we were very keen to work with your organisation. Such an active group, and looking at the kind of resources that you offer and also your membership, it seems really supportive. And that's, I know we were talking about earlier about how it can be really powerful to share and hear other people's experiences. Just in regards to your question, thinking about how specific it is, that's something that we really wanted to consider. Some people with pulmonary hypertension have spoke about the difficulties of having generic self-help, for example, where it's kind of a self-help for anxiety for the whole population. And while that can be really useful, sometimes it misses out on some of those specific challenges that we were talking about earlier that is related to pulmonary hypertension. So we've considered those aspects as well.
Right. And on a very sort of practical, logistical point, you talk about there are times that you'll be contacting them and filling out questionnaires. So this is something they do at the comfort of their own house and not having to go and visit anywhere. This is online type material, and the booklets, they've got hard copy booklets. They're filling out the questionnaires, so they're not leaving. They don't have to make appointments to do things.
Yeah, absolutely. And that's one of the real benefits of self-help manuals. You can do it in the privacy of your own home. And you can do it when you want to, when you're feeling able to do that. At the time, with COVID and also winter coming up, people might want to venture out as much as they used to. So this is something that they can do, as I say, in their own home. And it's their booklets. They can scribble on them, they can draw on them, they can fold them up and put them in the bag, or they can do anything with them.
And it's obviously it's completely free. The booklets, you can talk about booklets, etc. But there's no cost to this. I mean, to me, it's if somebody was just thinking, oh, I'm not sure, I've got anxiety, what would you sort of advise? I know you're sort of leading on the study, but if they're not sure, what do you think they should do? If they're listening to this podcast, think might be interested or might not. What's the next stage for them? Do you think, Greg?
Yeah, I think that's a really important question, and I think it goes back to this idea that not everyone experiences anxiety the same way. Something might be to go on the NHS website, for example, and look at symptoms of anxiety and see whether you can identify some of those. I think it was a really important consideration that you brought up earlier, and I'm really pleased you did, about social supports, our family, our friends. They might probably will have insights that are different to ours, and we can use that to kind of have a better understanding of how we're doing. And as I say, I always recommend speaking to your GP and discussing kind of your concerns, and your GP will be best placed to know what services in your area are available.
And I suppose this self-help intervention that we're talking about here and developing is that it's readily available, so it'll be there if it's appropriate. You can access it straight away. You don't need an appointment and things like that. That's what we're trying to explore with this study, isn't it, Greg?
Yeah, absolutely. And I think that's something that PHA UK do really well. These manuals, and you've got a range of them on pregnancy, for example, and medication, and all these resources that are really beneficial. And these resources focused on anxiety specifically could contribute. Mm-hmm. I think the most important thing is that anxiety is normal, and everyone experiences it, and we all go through stages in our life where we might experience more anxiety than we have previously. You're not alone. It's common to experience anxiety with a long-term health condition. Long-term health conditions come with a lot of challenges, a lot of demands, and as I was saying, a lot of difficult emotions and difficult thoughts. And as I say, it would be normal to experience distress from time to time. Take-home message is there are services and resources out there that can help. And sometimes there's some barriers to getting help, but just to recognize that it's a brave step to talk to someone about these, and it's an important step.
Yeah. And you know, again, this is reassurance, and I'm personally reassured as well from that is that anxiety worry is normal. Our studies showed, you know, more than nearly 60% of people with pulmonary hypertension really put their hand up and said at some stage that they've experienced it. Probably higher than that, really. And the first thing to do is to understand things can be done to improve that, just the same as with, hopefully, with symptoms of you say, long-term health conditions like pulmonary hypertension. But we have to seek help for that. And it is a brave step. It's probably braver to say, I have a problem here, than not to say anything at all, which is, you know, if that makes sense, it's a really brave thing to stick your hand up and say, I've got a problem here, and you know, I'm not weak, and it's the bravest thing I'm ever going to do, so I want to have a chat about it. That's the starting point.
Yeah, absolutely. And again, just emphasizing that point that we all experience anxiety, regardless of our age, our background, our gender, regardless of many factors.